Lower creatinine fast with these 5 kidney-safe fruits. You got your blood test back, and your doctor mentioned the word creatinine. Maybe your levels were high, or maybe they were creeping in that direction. Either way, you left that appointment feeling more confused than when you walked in. Here is something most people do not realize. What you eat every single day is either helping your kidneys or quietly making things harder for them. In this video, you will discover 5 everyday fruits that are gentle on the kidneys, naturally support better filtration, help reduce creatinine levels, and are easy to find whether you are. Let's start with something that might surprise you. One of the biggest reasons creatinine levels creep upward has nothing to do with eating the wrong foods. It comes down to something far simpler. Your kidneys are not getting enough fluid to do their job properly. You wake up, have a coffee, maybe another one mid-morning, a fizzy drink at lunch, a cup of tea in the afternoon. By the end of the day, you have had very little plain water at all, and your kidneys have been quietly struggling to flush waste from your blood the entire time. This is where watermelon steps in, and it does so in a way that feels effortless. Watermelon is made up of more than 90% water. That means every time you eat a slice, you are giving your kidneys the fluid they need to filter creatinine and other waste products out of your bloodstream. And unlike drinking several glasses of water, which some people genuinely find difficult to keep up with, watermelon feels like a treat rather than a task. What makes watermelon particularly suitable for kidney health is its naturally low potassium content. When kidneys are under stress, they can struggle to regulate potassium levels in the blood, which is why many kidney-friendly food lists are careful about high potassium foods. Watermelon sits comfortably in the safer range, which means it supports without adding unnecessary pressure. It also contains a compound called citrulline, which helps improve blood flow. Better circulation means your kidneys are receiving a steadier supply of blood to filter, and that supports more consistent waste removal over time. For practical use, aim for roughly 1 to 2 cups of fresh watermelon per day. Morning or early afternoon works best since it gives your kidneys active working hours to process the extra hydration. Avoid eating it late at night if you already find yourself waking to use the bathroom frequently. One important note: if you are already in a more advanced stage of kidney disease, speak with your doctor or dietitian before increasing watermelon intake, as individual fluid and sugar needs can vary. Before we get into the first fruit, I want to ask you something personal. Have you recently had a blood test that showed your creatinine was higher than normal? Or maybe your doctor used words like early kidney decline, and you left that appointment feeling more confused than reassured? If that sounds familiar, you are in exactly the right place, and this video was made with you in mind. Drop a 1 in the comments right now if your creatinine levels are something you are actively trying to bring down. Drop a 2 if you are here because someone close to you is going through this and you want to help them. And if you want straightforward, trustworthy guidance on protecting your kidneys naturally, make sure you subscribe to the channel and turn on the notification bell. We put out content that is designed to genuinely help, and you do not want to miss what is coming next. Now that we have covered hydration, let us look at something slightly different. A fruit that works from a completely different angle, targeting the inflammation that silently damages kidney tissue over time. Hydration is one piece of the puzzle, but there is another process happening inside the body that most people never hear about, and it plays a huge role in why creatinine levels rise in the first place. That process is inflammation. When your kidneys are under constant low-level stress, whether from poor diet, high blood pressure, or simply years of wear, the tissue inside them becomes inflamed. Not the kind of inflammation you can feel or see, but a slow, quiet kind that gradually chips away at how well your kidneys can filter your blood. Over time, this makes it harder for them to clear creatinine efficiently, and your levels begin to climb. This is where blueberries become genuinely valuable. Blueberries are packed with natural compounds that help calm this kind of internal inflammation without any harsh side effects. They work gently and consistently, which is exactly what struggling kidneys need. No sudden shocks to the system, just steady, reliable support. What makes blueberries particularly well-suited for kidney health goes beyond their anti-inflammatory properties. They are naturally low in both phosphorus and potassium, two minerals that damaged kidneys often struggle to process in large amounts. This means you can eat them regularly without the concern that comes with many other fruits that might otherwise be off the menu for someone watching their kidney health. They are also widely available year-round in both the UK and USA, either fresh or frozen, and frozen blueberries retain their nutritional value extremely well. This matters because consistency is everything when it comes to supporting kidney function naturally. A fruit you can only find seasonally is far less useful than one you can reach for every single day. A practical serving of around half a cup to 1 cup daily is enough to make a real difference over time. Stir them into porridge in the morning, blend them into a smoothie, or simply eat them as they are as a mid-morning snack. They require no preparation and no effort, which makes it far easier to stay consistent. And consistency, as you will see with every fruit in this list, is what actually moves the needle. Speaking of which, the next fruit on the list is one many people already enjoy regularly, but have no idea it carries specific protective benefits for the kidneys themselves. So far, we have looked at how hydration supports kidney filtration and how calming inflammation helps protect kidney tissue over time. Now we are going to look at something slightly different. Active protection at the cellular level. Your kidneys filter roughly 200 liters of blood every single day. That is an extraordinary workload, and it means kidney cells are constantly exposed to oxidative stress, a kind of internal pressure that gradually weakens and damages those cells if left unchecked. When kidney cells weaken, their ability to filter creatinine from the blood declines, and that is when levels start rising in ways that show up on your blood tests. Red grapes address this directly. The deep red and purple skin of these grapes contains natural compounds, particularly resveratrol and flavonoids, that work to shield kidney cells from this kind of daily oxidative damage. Think of it as a quiet protective layer that helps your kidneys stay resilient against the constant demands being placed on them. These compounds are not found in the same concentration in green or white grape varieties, which is precisely why red grapes stand out when it comes to kidney health specifically. Beyond cell protection, red grapes are also low in potassium compared to many other fruits, making them a practical and safe choice for people who are actively managing their kidney health and watching their mineral intake. They are gentle on the kidneys rather than adding to the workload. Portion size does matter here. Around 3/4 of a cup to 1 cup of red grapes per day is a sensible amount. Eating them as a snack between meals works particularly well because it spreads their benefits across the day rather than delivering everything at once. You can also add them to a simple salad or eat them chilled, which many people in both the UK and USA find especially enjoyable during warmer months. There is no need to overthink this. Red grapes are affordable, easy to find in any supermarket, and require no preparation whatsoever. You simply rinse and eat. The key, again, is making them a regular part of your routine rather than something you reach for occasionally. Now, the next fruit is one that often gets misunderstood. Most people know the name but have never used it in the right way for kidney health, and that distinction matters more than you might expect. Red grapes work quietly at the cellular level to protect the kidneys from daily wear. But the next fruit on this list works through a completely different pathway, one that most people have never connected to creatinine levels at all. Let us talk about cranberries. They are either that sharp sauce that appears on the table at Christmas dinner or something vaguely associated with urinary tract infections. And while that second association is not wrong, it barely scratches the surface of what cranberries can actually do for kidney health. Here is what rarely gets mentioned. The kidneys and the urinary tract are closely connected. When bacteria build up along the urinary tract, that bacterial stress does not stay contained. Over time, it can travel upward and place real pressure on the kidneys themselves, contributing to inflammation, reduced filtration efficiency, and ultimately rising creatinine levels. Cranberries contain natural compounds that make it significantly harder for harmful bacteria to attach and accumulate along the urinary tract lining. Less bacterial burden on the system means the kidneys can focus on their actual job rather than dealing with added stress. This is a genuine and underappreciated benefit, but only when cranberries are consumed in the right form. This is where a lot of people go wrong. The cranberry juice sold in most supermarkets, the bright red bottles that line the shelves in both the UK and USA, is typically loaded with added sugar. And sugar, particularly in large quantities, is exactly the kind of ingredient that puts extra strain on already stressed kidneys. Reaching for that bottle regularly, believing it is helping your kidney health, can actually work against you. What you want instead is unsweetened cranberry juice, dried cranberries with no added sugar, or whole cranberries where possible. These are the forms that carry the real benefit without the drawback. A small amount goes a long way. Around a quarter cup of unsweetened dried cranberries, or a modest glass of pure, unsweetened cranberry juice a few times per week is enough to make a meaningful difference. It is a small swap, but the distinction between the right form and the wrong form genuinely changes what this fruit does for your body. If what you are learning here is giving you a clearer, calmer picture of how to actually support your kidneys through what you eat every day, please take just a moment to hit the like button. It costs you nothing, but what it does is quietly powerful. It tells the platform that this kind of honest, straightforward health content deserves to be seen, and it puts this video in front of someone else who may have gotten a worrying blood test result this week and has no idea where to start. That person might be sitting with a piece of paper showing high creatinine levels, feeling frightened and alone. Your like could be the reason they found this video today. That is not a small thing. Now, the final fruit on this list might be the one that surprises you most. Not because it is exotic or hard to find, but because it has been sitting in your kitchen all along, and you may have had no idea just how much it could be doing for your kidneys. Cranberries work in a way most people never expected. But the final fruit on this list takes that sense of surprise even further, because unlike everything else we have covered, this one requires no searching, no special health food shop, and no label reading whatsoever. You almost certainly already have it at home. The apple is possibly the most taken-for-granted fruit in existence. It sits in fruit bowls, gets packed into lunchboxes, and gets reached for almost automatically without a second thought. And because it feels so ordinary, so completely unremarkable, most people never stop to consider what it is actually doing inside the body. That is a missed opportunity, particularly for anyone concerned about kidney health. Here is what makes the apple genuinely powerful in this context. The skin of an apple contains a natural fiber called pectin. Pectin has a particular quality that is directly relevant to creatinine levels. As it moves through the digestive system, it binds to waste compounds and helps carry them out of the body before they ever reach the kidneys for filtering. This effectively reduces the overall waste load the kidneys have to manage, which over time can support a gradual and natural reduction in creatinine levels. This is why keeping the skin on matters. Peeling an apple before eating it removes a significant portion of this benefit. A simple habit change, choosing to eat the apple as a whole rather than peeled, makes a real and meaningful difference to what your body actually receives from it. Apples are also low in potassium and phosphorus, which, as we covered earlier, are two minerals that need careful management when kidney function is reduced. This makes the apple a genuinely safe and reliable daily choice, regardless of where someone is on their kidney health journey. One apple per day, eaten consistently, is enough. It fits into any routine, suits any budget, and works across all seasons. There is no complicated preparation involved and no learning curve whatsoever. The beauty of the apple is not just in what it does, but in how effortlessly it fits into a life that is already being lived. Sometimes the most powerful changes are the ones that ask the least of you. And that thought leads us perfectly into the final part of this video, where we bring all 5 fruits together and look at what consistent, realistic action actually looks like going forward. You have just covered a lot of ground, and none of it required a medical degree to understand. That was the whole point. 5 fruits. 5 simple, accessible, affordable additions to a daily routine that most people are already living. No dramatic overhaul, no expensive supplements, no complicated meal plans that fall apart by day 3. Watermelon to bring consistent hydration and help the kidneys flush waste more easily. Blueberries to calm the quiet internal inflammation that chips away at kidney function over time. Red grapes to actively protect kidney cells from the daily oxidative pressure they face. Cranberries in the right form to reduce bacterial stress that the kidneys should never have had to deal with in the first place. And apples, sitting right there in your kitchen, carrying fiber that reduces the waste burden on your kidneys before they even have to get involved. Each of these fruits works in its own way. Together, they create a pattern of eating that genuinely supports your kidneys without asking very much of you at all. Now, a question that often comes up at this point is completely fair and worth addressing honestly. Can natural approaches like these replace medical care? The answer is no, and it would be wrong to suggest otherwise. If your creatinine levels are elevated, if you have been diagnosed with kidney disease, or if you are under the care of a doctor or specialist, please continue that relationship. Keep attending your appointments. Keep having your blood work checked. What you eat can absolutely support your kidney health and work alongside medical guidance, but it should never replace it. Think of these fruits as something you do in addition to your care, not instead of it. What they represent is agency. The ability to do something positive and realistic every single day that contributes to your own well-being. And that matters more than most people realize. Small choices, repeated consistently over weeks and months, are what create real change. Not one perfect day, but many ordinary days where you simply made a slightly better choice than the day before. One last thing before you go. Think for a moment about someone in your life, a parent, a friend, a partner, maybe even a colleague, who has mentioned feeling constantly tired, who has been told their kidneys need watching, or who has quietly been struggling with their health and does not know where to turn. Share this video with them today, not tomorrow. Today. Because the information in this video is exactly the kind of practical, reassuring guidance that people in that situation are desperately searching for, but rarely find explained in a way that actually makes sense. A single share from you could set someone on a completely different path. That is worth 30 seconds of your time. If this video gave you even one useful thing to take forward, that is enough to start with. If it helped you, please give it a like, because it genuinely helps this channel reach more people who need this kind of information. Leave a comment below telling us which fruit you are going to try first. And if someone you care about has been dealing with kidney concerns, share this video with them. It might be exactly what they needed to hear today. Thank you for watching, and take good care of yourself.